So, when I was telling you about the kind of HarleyDoc's tech offering, I think that the family medicine model has worked for generations and is, what we all miss and is very good. But I feel like the NHS hasn't modernized, during that time. And it really needs to. I think that, we're now living a faster pace of life than ever before, and people demand excellence and they demand access and they demand, things getting sorted immediately. And, rightly so, because their lives are so fast paced, they want that to be the case with the healthcare as well. So we really wanted to infuse that traditional model with our kind of AI and tech. And so we've basically just launched our HarleyDoc app, which has been a huge undertaking and a big project, which we're really proud of. But it's a real-time doctor-patient interface that sits on the patient's phone, in their hand, wherever they go in the world. And this is their electronic patient record, so they can access their consultation notes, their medical records, their medications. And, they can order medication, so we have a medicines management platform on there. We partner with what I would describe as the Uber of pharmacies, who can, get your medication to you in your busy city office within, an hour of you asking for it, which is incredible. The same app offers you the video consultations, telephone consultations. It offers you appointment booking service. It has a symptom-based triage system. So one of the things which I always say is that patients don't present with a disease, they present with a symptom. And we have to really focus on what that symptom is, because there's multiple causes of that. And the best way to triage that is to, start with a symptom and then work on from there. So we have a very intuitive system which will ask the right questions based on what you're putting in. And we feel that that lets triage people's problems appropriately. So for instance, somebody who has a pain of 9 out of 10 sudden splitting headache will be prioritized over somebody who's had a dull headache for the last 3 months. So HarleyDoc is the world's first truly global concierge healthcare service. We offer a membership base, so people sign up as members annually. For that, they get 24/7, 365 access to a named doctor. They can literally put in queries to and get instant responses, any time of day, wherever they are in the world. We wanted to cater for a multinational clientele, which we were seeing more of over the last decade, who live in central London but perhaps work elsewhere. And they're very busy with home lives, personal lives, work lives. And so, they deserve excellence in the clinical care that they get. And hopefully HarleyDoc can cater, for them. So we actually offer different levels of service. So HarleyDoc was originally created to look after individuals and their families. And we realized there's a really good opportunity for us to enter into small to medium businesses as well as an in-house occupational health service. So, as an employer, you get to offer your employees a very direct medical service, which is individualized to their needs. But as an employee, you feel like you're looked after and that you can access people before, the stress becomes kind of burnout. And we also, through our app, have clients who are very interested in white labeling for clinics and hospitals, so they could take our technology and use it for their patient population. But we also work at a governmental level. So because of the technology that we're using, it offers remote and rural communities access to healthcare, which perhaps in the world they hadn't previously had. So the HarleyDoc app was built because we already had a web-based offering, which was working fine for our clients, but we recognized as we were growing that we needed to explore the option of having a mobile phone-based app. Now, the reason we wanted to do that is because mobile phone travels with you everywhere. It's instantly accessible, and all that you need to have, for the technology that we've got is a phone with a camera. And if you have a phone with a camera that's connected to, Wi-Fi, or you have network coverage, you can access our app and use all the services. There are apps out there that just offer an electronic patient record. There are apps out there that just offer some remote patient monitoring. There are apps out there that just offer video consulting. We really wanted to create a one-stop shop for people's healthcare, and that was literally in the palm of their hand that they could access wherever they were in the world. And so that's what our app is. It's a combination of an electronic patient record. It's a combination of video consultation, telephone consultations. It offers people a symptom-based triage system. They can book appointments, so that can be telephone, video, face-to-face, or home visits. We offer people access to our education and training hub, but we also offer people the remote patient monitoring technology. So the facial scan is something which has garnered so much interest from our clients, but also businesses and, kind of local NHSs as well, because they see the value in having that as an opportunity to shift resources away from the NHS and perhaps do some of that monitoring at home. I think people will choose us as their healthcare provider at HarleyDoc because what we offer is unique. And so we offer a hub and spoke model where you as the client, me as your named doctor, your GP, I act as the hub for you. So any query that you have comes to me, and we have a closed network of specialists, most of them in-house. Some of them we might need to go to our kind of partner clinics, but we have them within our network. So whatever your need is, we have the imaging, we have the pathology services, we have the specialists for you to speak to, usually same day, depending on their availability, of course. And we also have our own kind of vehicles that can pick you up and bring you to our clinic. We can do home visits. So we have tried to think of everything where problems can arise in healthcare, and we've tried to address them.